Behavioral Health Justice Intervention Services project. My name is Monica Reeves, and I am the Senior Project Director for this project. And today I'd love to go over more detail about this opportunity. As we mentioned before, please submit any questions you have throughout this webinar in the Q&A box. If able, we will be able to respond to those directly in the Q&A box, or we will address those or address follow-up with those questions at the end of the webinar. You may also submit your questions regarding this grant opportunity to our email address at bhjis@ahpnet.com. We will be accepting questions regarding this grant opportunity through December 15th, 2021 at 4 p.m. Pacific time. And we will be sure to address any questions you have either through email or through a separate question and answer document that we may paste on the webpage. So Sonia provided a small amount of background on this project, but basically what the BHJIS project is it's the California's Department of Healthcare Services that's releasing this RFA for this project to help behavioral health agencies and first responder agencies, law enforcement, behavioral health providers, and other community stakeholder groups that want to improve and enhance their collaborative response to individuals facing mental health or substance use crisis. DHCS is contracting with Advocates for Human Potential to be the administrative entity for this project. And as a result, AHP will be subcontracting with grantees for this project. The goal of the BHJIS program really is fourfold. One is that we want to see programs that implement innovative solutions to problems in their communities and connect people experiencing mental health or substance use disorders with services at the right time and in the right environment. We encourage programs to utilize best practices such as those that are addressed in SAMHSA, BJA, and Crisis Now best practices, bringing notice to co-responder models such as the Memphis Model Curriculum or the CIT Post-Certified Curriculum. We would like to see agencies demonstrate collaboration between system partners in their communities, really with focus on collaboration between those first responder and law enforcement agencies and the behavioral health system. We'd also like to see an adoption of policies and practice to promote diversity, equity, and inclusion and establish culturally and linguistically appropriate services among these projects that we will be reviewing. Agencies that are eligible to apply are any public or private nonprofit entity in good standing and authorized to do business in the state of California, as well as any tribal entity, state or local government entity or school district. This includes law enforcement agencies, fire departments, community behavioral health agencies, or other community-based or qualified organizations that are interested in participating in one of these projects. Joint applications are definitely encouraged, yet AHP will only contract with one lead agency and will approve its subcontracting partners. Funding for this program is provided by the Coronavirus Response and Relief Supplemental Appropriations Act, or CRSA for short. We have about $16.25 million that we are allowed to contract for these BHJIS programs. Application requests can be a minimum of $50,000 up to $700,000 per awardee for the estimated contract term of February 15th of 2022 through February 14th of 2023. Each awardee will be required to provide a deliverable-based budget and budget justification, and agencies are responsible for ensuring that the proposed costs are allowable and that they meet the funding restrictions that are explained in the request for application. Funds can really be used for two different purposes under this grant opportunity. The first is capacity building. This collaborative planning, development, and training is actually a requirement of all of the projects. So a main component of your programs needs to be that collaborative relationship building that will take place among system partners in your community. We do have limited funds for first year implementation for hiring and contracting with behavioral health clinicians and or peers to be embedded with first responder teams for those teams that are responding to community situations or integration of harm reduction, reentry support, and other diversion strategies. Again, those funds are limited and are used for that first year implementation of embedding those co-responders. As I mentioned, all awards must include that collaboration and capacity building piece that we spoke of. So even if you are funding a co-responder or a clinician to be embedded in a first responder team, there still will be that overall requirement that the project has to include system partnering and collaboration among those system partners in your community. Our application timeline is as follows. The RFA, as you know, was released November 29th of this year. The question deadline I mentioned earlier is through December 15th, 2021 at 4:00 p.m. And those questions can be sent to BHJIS@ahpnet.com. We do request an optional notice of intent that is due December 15th as well. With the application deadline, the full application deadline due December 22nd, 2021 at 4:00 p.m. As part of that application, you must submit your full application in the online portal, upload a proposal narrative, your budget form, and your budget justification. And I will speak more about these requirements in later slides. Late application packages, however, will not be considered. So please make sure that you get those applications in no later than December 22nd. We anticipate an award announcement in February of 2022 with contracts proposed to start February 14th, or I'm sorry, start February 2022 and go through February 14th, 2023. We request that all interested parties please submit the optional online notice of intent by December 15th, 2021 at 4:00 p.m. Pacific Standard Time. We request this so that it allows us at AHP to better prepare and have an idea of how much interest is being expressed on behalf of this project, and help us to prepare to be sure that we have the resource available to efficiently address every applicant as they come in. How to apply is we ask you that you apply using the online application portal. This application portal is linked on our BHJIS website, which is corresponding.calbhhs.com. And I believe we have a link that we're putting in our chat right now. In this online application portal, you must complete the online application, which is a series of questions, demographic information, questions about your agency and your system partners. We also ask that you upload the budget form, which we also have attached in this website. We also ask you to attach a separate budget justification, which would be an explanation of every line item that you have in your deliverable-based budget form. We also ask that you upload proposal narrative questions, and these proposal narrative questions are actually embedded in attachment B of the RFA that is on the website. When you begin your application in the online application portal, you will be able to save your application and come back to it if you're not able to finish it all at one time. But once your application is fully submitted, you will receive a confirmation email. And if you are having any troubles or have any questions as you begin to fill out this online application, please feel free to reach out to us at BHJIS@ahpnet.com. I did mention that attachment B of the RFA has the summary narrative questions that we will ask you all to copy and paste into a separate document and answer those questions and then upload them to the online application portal. The proposals do have word limits, so we do ask that you adhere to those word limits in each section. We also ask you to plan ahead. As I said, we will not be taking late applications. So we really hope that you guys are able to, one, send us your notice of intent, and two, upload that application as soon as possible so as that you will not be late and disqualified from the grant opportunity. The actual application form, and again, this is the application form that is embedded in the online application. It provides an agency overview, has an explanation of the lead agency applying, and a description of the key partners that are involved. One important thing to remember is that key partners must be aware and be committed to participating in this project. So please ensure that you consult with those key system partners so that they are aware that they're participating in this application with you. We ask for the projected number of individuals with substance use and/or mental health disorders that will be reached by this project. Again, the number of system partners committed to working on the project, the projected number of unduplicated stakeholders, and a project abstract of 50 words or less. There is also a section that allows for those subcontractor or key partner roles and contributions. So we will be looking at that as part of the scoring criteria. So please be sure to describe in depth the contributions that those system partners will be making. The narrative questions really are based on three broad areas. One is the community need, the second is your project description, and the third is the applicant questions, including your collaborations. So for the community need, what we're looking for is what current community need are you proposing to address? And then describe those community partnerships and resources that you could that could be more easily established or are already in place that will support this project. The second, for project description, we would like you to describe in detail what your plan is to do for this project. List 2 to 5 expected direct outcomes. And then also please provide us the anticipated barriers that you have and perhaps some ideas of how you would overcome those barriers or how this project will help address some of those barriers. Finally, the applicant questions and collaborations. We would like you to describe the lead agency's qualifications, commitment, and plan to collaborate across the systems in your community. We would like you to discuss how you as the lead agency and the project partners will work together to carry out this project. We will also like to know is who will serve as the project director or the champion for this program. What specifically is their role and experience in integrating behavioral health with first responders and law enforcement is also a key piece that we will be looking for. We also ask that you provide a deliverable-based budget using the deliverable-based budget template. And what we mean by this is that we would like you to identify broad categories of deliverables that you have. For example, if you are doing a mapping exercise within your community, please roll up all of the supplies, the salaries, and overhead that might be a part of that project deliverable and include them as one solid budget category and one budget line item. And then in your separate budget justification, you can explain the costs associated with that deliverable and the more specifics around that deliverable. But ultimately, we want that budget form to really highlight those high-level deliverables that you plan to have out of this project, with that further detail provided in the justification and separate documentation. This slide shows the scoring that we will be using as we look at applications as they come in. One, we will look at that community need piece. We will look at your project description. We will look at applicant qualifications, including that collaboration piece. Notice that the project description and applicant qualifications and collaboration hold the most weight in our scoring for this particular project. We also look at the budget and budget justification for a total of 100 points that will be scored for each individual applicant. I do see that there have been questions coming up through the Q&A box, and thank you for that. We will take some time definitely to address some of those. If you have any more, please be putting them into the Q&A box. Also, submit any additional questions to BHJIS@ahpnet.com with the subject line RFA question. This will help us to develop a question and answer document that we may post on our website to allow all of the applicants to see the questions that are coming in. Again, questions are accepted through December 15th, 2021 at 4:00 p.m. And we really look forward to all of your interest and look forward to working with each and every one of you. Lastly, for more information, please visit our BHJIS website. The links are embedded in this PowerPoint, which we do have posted right now on our webpage. But visit the website. On that website has the online application, the BHJIS request for application, the BHJIS RFA budget form. And I also want to bring your attention to a document that we have called co-responder examples. This particular document has examples of different collaboration and co-responder projects that are in place across the nation that are examples of projects that could be funded through the use of these BHJIS funds. So go ahead and take a look at that. If you have any questions, please let us know. But remember to also submit that optional notice of intent by December 15th. Again, this will be to really allow us to be more prepared to serve you once the applications are due. And with that said, thank you so much for participating in this webinar. We look forward to answering your questions. And I'm going to turn it over to Deb Warner right now to address any questions that are coming up.
Hello, everyone. It is great to be here with you. And thank you, Monica, for providing the great summary. We are getting a number of questions, some of which I think we'll be able to provide answers here, some of which we will be providing through a frequently asked questions document that we will post on our website, but we want to make sure that the answers that we give you are correct. So I'm going to go ahead and go through some of the questions that we are some of the questions and answers, and then go ahead and also keep typing some of your questions in the box as well. So we have the question, is there a target number of participants that the contract is required to work within the year? And the answer to that question is no, there is no specific target number of participants. Somebody else has asked, what about county office that manages a coalition? I'm assuming that means are they eligible to apply? And the answer to that would be yes, the county offices are eligible to apply. There were just some summaries of examples of different kinds of agencies provided in the eligibility criteria. Someone else also asked whether county behavioral health agencies are eligible to apply, and that answer is also yes, they are eligible. And then there are a few questions related to the funding. One question is there a limit to the percentage of funds that can be used for training with capacity building or a ratio to other funds? And then a couple of people have asked about the piece related to that there is some funding available for direct service, but the primary purpose is really the capacity building aspect. One thing that is very important to remember related to these projects is that they are scheduled to start in February 22, and all funds must be used by February 14th, 2023. There's no layovers, there's no extensions. This is per the federal requirements on the funding source. So we are not looking for proposals that provide a whole lot of implementation startup funds without a clear plan of how you're going to continue that after February 2023. But instead of really are also thinking through building the capacity, the sustainability for the programs that you're looking at, putting those kinds of pieces into place. With that said, there is not a specific cap on the amount that can be spent in initial implementation direct services. It is not It is not that you can spend X amount on capacity building and X amount on training. It's just to think through as you're delivering it, what you're going to really be able to accomplish in this period of time. And for more information related to the funding, you can go to page 4 of the RFA. And that gives a little bit more information related to the funding. Somebody has asked if we already have a co-response team with one law enforcement agency, would costs for working with a new law enforcement agency count as first year implementation? And that does sound like, yes, that would be allowable, thinking through the capacity building related to working with that new law enforcement agency, what would be involved there. You could also be looking at working with, law enforcement is one method of co-response. You could be working with fire departments, with school or housing authority response personnel as well. So most co-respondent models are focusing with law enforcement, and that is definitely a part of this, but there are other options that you could be building in as well there. And that's another one around the funding. I think I've addressed the funding questions all in one group. Somebody asked if the slides will be shared, and those are available already on the website. Somebody has asked for an example of what a budget justification would look like. We do not have a specific example of a budget justification, but what we'll be looking for is something that justifies. So in your deliverable-based budget, you're going to be listing sort of the deliverables that you're creating with a summary of the cost. Your budget justification will help us understand how you're getting to that cost. So what salaries are being included, what direct services, if there's any equipment, all of those details of what you're looking at to provide that information. And a couple people have asked about questions, so you're also seeing and hearing some of the answers to questions. Continuing on to other questions. Can you clarify collaborative? Are programs expected to work collaboratively with local police? So we are looking for pieces where it is not just a behavioral health provider trying to work in isolation to build a co-response system. We know that that does not work very well. We also are not looking for applications where a law enforcement agency or a fire department is really working in isolation to try to address co-response and improving response to behavioral health crises, or a community coalition, which is really looking at trying to improve responsiveness related to diversity, but they haven't been working and they don't have those linkages already with building some of those dialogues with some of those other, the law enforcement or fire or behavioral health. We are looking for groups that will be working together. With that, I will also add, while we don't require memorandums of understanding as part of the actual application, and Monica may have actually already said this in the presentation, we were concerned that there wouldn't be time for that as the applications are due December 22nd. But that may be one of the deliverables that you're working on is concrete MOUs, or you'll be getting those kind of at time of contract, depending on how you want to work it. You also want to make sure that whoever you're listing there as partners know that they're listed as partners, so that this is not about we're just going to create everybody under the sun and say we will work with them. You should be reaching out to them prior to the submission of the application and seeing whether they will work together with you. What are other types of acceptable collaborations? For example, as a nonprofit, we wouldn't have one of our clinicians embedded in a first responder team, but we would want to work with the city's crisis response team. Is that acceptable? I don't think that would capture the I don't think that would capture the interdisciplinary nature of this approach. So it would depend on what you're looking for. But again, think of that interdisciplinary, that this is around how do we help improve behavioral health, working within other systems and with other system partners to be able to address responses and needs in our communities. is technology an allowable capacity building expense? We will confirm that with DHCS, and we will let you know that part. Yes, the system will be recorded. Is collaboration with the jail considered first responders? So jails are staffed by sheriff's offices. So that could be considered co-responding with criminal justice personnel. So think about it in terms of that. That's not necessarily providing services within the jail, but thinking about how you're providing services to improve or prevent behavioral health crises as people are being released. In the section regarding community partners, we intend to go through a couple RFP processes to select providers as partners. Since we don't currently have partners or providers, shall we explain the intended work of the providers in that section? That would be an option. I will just caution you that this is 1 year worth of funding. So how you would quickly go through an RFP process and get all of this accomplished in that 1 year period may be difficult. So thinking about that in terms of what your best model is in terms of your capacity building. We have 2 locations under one entity, but the locations have different DHCS license numbers. Would we submit 2 separate applications? Since this is about co-response in the community, I am not sure that there's not enough information here to make that determination. So we will respond to, so if you want to provide additional detail, we may be able to help you with that. Can you speak to the level of detail which you'd like in the budget justification? For example, would you like total salaries or a breakdown by staff member and FTE? I would say assume that we would like the breakdown by staff member and FTE. The budget is scored in terms of cost reasonableness as well as how it fits with your project objectives. So think about how you want to be delivering that message in a way that you're going to get the maximum number of points. Funding announcement will be in February. Is there a contract required? This will become an issue because it takes our county approximately 3 to 4 weeks to get it approved by our county council and board of supervisors. Can you send out the county contract template sooner so we have county council review ahead of time? The answer to that question is yes, this will require a contract. The contract will be with Advocates for Human Potential. We're the administrative entity working with the Department of Healthcare Services. And I cannot promise that we would send out the contract template ahead of time, but would certainly do our best. We recognize that with counties, it can take some time, and try to work with you all to get things done as quickly as possible. Will this also apply to behavioral health crisis for individuals with developmental disabilities? These funds are specific to mental health and substance use disorders. There are individuals that do have co-occurring developmental disabilities, but the focus here is around mental health and substance use disorders as it's SAMHSA funding. Can fiscal sponsors apply? I think the answer to that would be yes. You'll just really want to clearly establish the relationship as you're describing and how this is going to work together as part of the application. And typically those, can a mental health nonprofit partner with schools deliver mental health support and trainings, or does it have to be with the first responder agency? And does a first responder agency have to be involved? So again, really with this is not around just general mental health support or mental health trainings. This is really around how you handle co-response. So if you were working, say you're working in a school and your school would normally send out a disciplinary team for a response, identifying how you could build that partnership so that it was not just the school, unfortunately, I'm not recalling what they're called, like the school police that would go, but also have a behavioral health partner that would be working with it. Is there any cost sharing or matching funds? There are no cost sharing or matching funds required for this. I will also just add that these are funds of last resort. So you don't want to be, you don't, and you want to be careful not to supplant any existing funds. We are developing a community crisis responder program consisting of mental health professional and a medically trained EMT who will respond to certain types of 911 calls in collaboration with local law enforcement. Does this fit your program? I believe that yes, this does sound like this is an exact example of the kinds of programs that would fall within this. It's a mental health professional EMT working with an EMT in response and collaborating with law enforcement. For school districts, this application period is not sufficient time to prepare a grant application. How are school districts expected to write a grant, then get it approved by cabinet and the school board in time to submit the application? We do recognize that this is a very difficult timeline. DHCS's goal is to get this fund out to the community as quickly as possible. Again, because we don't want to delay in the response, because there's only 1 year in terms of the ability to apply. So it may be that if you are working with a school district, somebody else may need to be the lead applicant on the application. Can you confirm that grantees will not be expected to collect GIPRA data? That is correct. This is also primarily capacity building as well. Is there a limit on indirect administrative costs? We will confirm that and get back to you. 10 organizations or just one? I'm going to guess what the meaning of that question is. We have not actually put a limit on the number of applications an organization could submit, either as a subcontractor or as a partner or as a lead agency. Though we are paying attention to making sure that as many applications as possible across the state. And this is really an opportunity, I think, for expanded innovation within services and with some systems. So you may want to, especially with this timeline, focus on one proposal, but you could be submitting more than one. Can a for-profit community behavioral health clinic or institute eligible to apply in partnership with local law enforcement department? The answer is the for-profit is not eligible as the lead agency. The local law enforcement department would be eligible to serve as a lead agency. And nonprofits are eligible to serve as lead agencies. In answer to the next question, will all Q&A be available to participants prior to the submission deadline? That is our goal, is to get this information out to you all as quickly as possible. That's why we're answering questions quickly now, as well as going back and providing the answers later. Can the grant funding training of dispatch to divert behavioral health calls to behavioral health crisis response team as opposed to having a PD response? That question, as far as I know, that there likely would be an opportunity to apply for that, but without having more detail, I can't answer that for sure, so I will check with you. But the other piece to remember is if you already have other funding to handle that, then that wouldn't be a use of this innovative kind of funding piece. Because I think that there is already some funding sources available for training dispatch. But if that's not the case, then that probably would be allowable as long as there are those behavioral health crisis response teams. This is 1 year only funding. And I think I've already said we do not require the MOUs with your stakeholders and providers at the time of application, but do make sure that they are fully on board. I believe that we asked for the name and contact person as part of the application. Can these funds be used for youth as well as adults? The answer to that is yes. Will it work for a current program or does it have to be a new program? We are looking for capacity building, which enhances, augments, creates new programs or services. So if it's an existing program and you're just looking to continue it, that would probably not be an appropriate use of these funds. But building the capacity to expand or augment or enhance it, then that would be fine. Somebody's asked what the word count total is. The word counts are per section of the proposal, not for the total application. We are working on the types of data that will be requested in the quarterly reports. They will be data metrics that are also required by SAMHSA. And you will receive follow-up information related to what the types of data are. Again, so a lot of it is going to be around capacity building, and then there will be some also, if you're implementing the model, indicators related to that. Can you serve a specific population, for example, teens or young adults? The answer to that is yes. Do we need to provide written agreements? I've answered. Once a grant is awarded, what percentage of the funds will be provided to the upstart of the program? That is not set at this point in time. I can potentially get back to that, but I think that using a deliverable-based schedule, initially you will invoice at the point where you have completed some deliverables. There may be some deliverables that you can complete at the beginning of the grant. That would make that helpful in terms of your startup, and whether there would be some ability to pre-bill for some things would be handled. That I'm not sure, and I would say that could be handled on a contract basis if you're interested in applying. Are schools eligible to apply, or is it only agencies of the law enforcement? Yes, schools are eligible. Somebody is asking, what is DHCS? And I'm sorry, it's the Department of Healthcare Services. The California Department of Healthcare Services is the funding source for this RFA. Can you speak to your vision regarding target population and avoidance of unnecessary higher levels of incarceration? I think the target audience, as is really indicated pretty clearly in the introduction and background, which describes, individuals who are experiencing behavioral health crises, maybe in the community, maybe that they're moving back towards a re-entry into the community from the judicial system. Would a state, university, county, hospital system to apply as the project director in collaboration with community partners? I will have to check in terms of the state university. A county hospital system would be eligible to apply, assuming it's either operated by the county or is a nonprofit. Can you clarify capacity building? If you look on page 3, page 3 and 4, there are some examples of capacity building activities that are examples of what is included in this RFA to make it so that you are better able in your community to have a response to behavioral health conditions that are the behavioral health conditions that's an alternative to an immediate response of people being law enforcement responding, people ending up quickly in the jail system or the community hospital system, but instead are being able to provide some additional services and divert some of those individuals as appropriate. That was not the best example of capacity building. One of the other aspects that we recognize is important here in terms of capacity building is also addressing some of the social inequities and structural inequities in our communities, potentially doing some work around having a thoughtful DEI response when law enforcement is called to work with somebody who has a mental health condition or a substance use condition, and building a stronger system that is more aware of DEI issues. Are there any travel and meeting expectations that you should budget for? Thank you, Elena. That is a great question. There is the delivery of technical assistance and learning collaborative sessions that you will be expected to participate in, as well as some webinars that are available. If it is not in the RFA, we will add it as part of this question and answer to assume that you will attend 2 learning collaborative meetings in Sacramento in person. I think that's being optimistic. We will determine at a later point whether they are going to be virtual or in person, but do build that into your budgeting, as well as coaching calls and some of those other supports. You will need your partner budget information if you're planning on having your partners as subcontractors, because those costs will need to roll into your deliverable cost. You won't be able to just include that as a lump sum. Could the proposal be between county facilities like an infrastructure for medication-assisted treatment, induction, and handoff between behavioral health, emergency psych units, and jails? I know funding is needed for the aged, IT, telehealth capabilities in jails. I don't think this quite provides enough information of what this specific question is, so I would encourage you to ask a specific question, paying attention to the fact that we are really looking at those linkages for behavioral health response to populations that are at risk of criminal justice involvement. Faith-based, yes, you can work with faith-based organizations. To be eligible for the faith-based organization, if they wanted to be a lead organization, they would also need to be a 501c3. Do deliverables need to be data-driven, number of clients served, or can it be the increments requirements of building a collaborative team? I would say that you could have both. Number of clients served are certainly strong deliverables, and you could break those into, say, quarters, as well as recognizing that some of the capacity building doesn't really have those numbers attached. So you can identify other models of collaboration. Collaboration with California Parole would be an example of a co-response team with law enforcement. I think that would depend on how that was set up. How are you actively demonstrating that there is co-response? But that is certainly possible. Children's unit would like to apply as well as our adults unit. Can each send an application or just one county application? At this time, you can accept more than one application. Somebody is asking, can we obtain a hard copy of the application? The questions in the application form are included as an attachment to the RFA. Are you looking for new policies and procedures that can be implemented at the local level? That would be an example of capacity building. How many awards are you thinking of for the 16.25 million? We're anticipating, because the maximum award is 700,000, but there's also a wide range. I believe that we're considering between 32 and 40 awards. Would placing a mental health professional in a school be eligible? Only if that person is being partnered in a way that is not just to provide the behavioral health services, but also to do some of that alternative response to crisis or when somebody is called. But then, yes, it should be an allowable piece. Are nonprofit hospitals considered eligible? The answer is yes. Now I'm not feeling like I'm going to get through all of these questions in time, but I'm just going to keep going. If I miss your question, then we will respond to all of the questions also in writing. Can different collaborators on the same project each submit an application for funding for their piece of the project? I do not believe that that would be considered responsive, because then how would you demonstrate that you are collaborating? But if you really had to do that and make a strong case, then I suppose that would be possible. Would a reentry team from incarceration to linkages with mental health and other services be eligible? Demonstrating again that that is building those linkages, then that should be eligible. How many hours do you expect for technical assistance and training? Somebody who's just right in the groove here. It depends on who your team is, but if you wanted to, like for budgeting purpose, maybe assume 2 hours per month for coaching calls, say 2 hours per month for 2 to 4 hours per month per person for attending of webinars and technical assistance services or reviewing documents. And then the learning collaboratives are quarterly, and this for purposes of just responding blindly, assume a day per person per month for each of those four. Can you share the partner, share the funding, or does it only go to the applying agency? Partners can share the funding, but we would give the funding to the lead agency, and the lead agency would be responsible for giving it to the other services. Is a dual diagnosis outpatient program facility for substance use or mental health services eligible? Not for just the delivery of dual diagnosis outpatient services. You would have to be building capacity, working directly with some of those co-responders to improve access and services for people who are in the community. And it looks like I have at least gotten to the end of the list. I do think I missed a few of the questions as we were going, but let me go ahead and just pause for a minute and see if Monica, Sonia, Minal, Lydia, Jennifer, if anybody wants to add anything.
Hi, everybody. This is Monica. Thank you for the very robust list of questions. And I just wanted to let you all know that we will be compiling all of these questions. We will be providing our answers, and we will be posting the document on our website as soon as possible. So we're going to need a few days to make sure that we compile these and get the best responses that we can as we partner with BHJIS on this. So please be looking for that. And we could even possibly send out, as you guys being enrolled in the webinar, may be able to send you an email directly notifying you that they're on there. But I just wanted to say thank you for the great questions. We're really excited about the energy that's around this, and look forward to answering all of the questions.
Thank you. And then just kind of as a last two little questions, one person said, does the mental health professional have to be a licensed clinician? Can they be a peer? You can include peer services as a part of your co-responder services. And somebody else has asked that we put the website into the question box. And yes, if you have PWI, this is a separate project. So if you have existing other funds, such as the PWI funding program, you want to make sure that this is a separate project and you're going to do completely separate activities. You can't supplant those other funds, but you are still eligible to apply. And with that, I think we can go back to Monica and Joe and go ahead and close out. Looking great questions. You've gotten me thinking. Mm-hmm. And we are really looking forward to your applications.
We are. Thank you guys so much for attending. Again, we really appreciate your energy and interest around this topic. We hope to be working with many of you very soon, and be on the lookout for the responses to the questions. And just one last thing, if you wouldn't mind, please fill out that optional notice of intent so that we know or have an idea of who is interested in this opportunity with us. And that's all I have. Joe, do you have anything else?
That wraps up our webinar today. We'll leave the room open for a moment or two so you can grab any links that you might need out of the chat box. Any links that have been put into that chat box are available from the slides, which are also posted to the website. So we'll make sure you have that link as well, but you can get any of the links that are here in the chat box over on that slide download as well. Thank you all so much for coming. We'll close the room out in about 3 or 4 minutes. If you do have any additional technical questions, go ahead and put them in the chat box. We are not monitoring the Q&A any longer, but we do encourage you, if you've got a need for help, to let us know. We'll be here for you. Thank you all, and enjoy the rest of your day.